much. Right now, we do want to turn to the latest on the coronavirus here in Connecticut. Yesterday, we told you all about how the state is now allowing nursing home visits to resume, but this all comes with some stipulations for families. And joining us with some helpful suggestions is Jennifer Labrie. She is a memory specialist with the Connecticut chapter of the Alzheimer's Association. Thank you so much for being here.
Thank you for having us on.
So obviously this is something that families have been waiting for many months now. They're looking forward to it. What do they need to know before showing up at these various facilities?
Sure. So I think most important right now is preparing and calling the facility ahead of time, making sure you're scheduling your visit and not just walking in unannounced like we might have been able to do 6 months ago. Expect when you get there to have your temperature checked, to have those typical COVID screening questions asked, and obviously wearing our masks and keeping that 6 foot distance to keep everyone safe. Also talking with the nursing home staff and family liaison that may be there. What can you do or bring right now into the facility? Do they allow food or special sweet treat, music, flowers, cards from grandchildren? What can you do to help your loved ones stay engaged and connected during your visit?
That makes a lot of sense. For many people, they've only been able to see their loved one through a window or some type of glass barrier. This is going to be the first time that they're seeing grandma or grandpa in a very long time, or maybe their mom and dad. How do you suggest they are able to reconnect? Because I imagine there might be some trepidation in seeing them for the first time.
Sure. So first, I want to say nursing home staff has done a wonderful job of keeping people connected virtually, updating them over the phone, doing FaceTime and even outdoor visits. But it is different going back into the facility now to visit. So we need to keep in mind Alzheimer's disease as well as other dementias are progressive. So our loved one may not seem exactly the same or be acting the same. There may be some changes that seem sudden to us, but have been a progression over the past 6 months. But going into the facility may be a little different, but preparing ahead of time and just focusing on that visit and quality time with your loved one.
And Jennifer, before you go, is there anything else that families need to consider before visiting one of the nursing homes?
Sure. Focus again on that feeling. People with dementia are so much more in tune with our body language, tone of voice, our facial expression. We have to smile with our eyes and stay connected. But I encourage anyone to reach out to our 24/7 helpline if they have any questions or unsure about a visit or want to plan for their visit. We have a 24/7 helpline at 1-800-272-3900 that anyone is welcome to call.
Well, this is certainly some good news, and you definitely provided families with a lot of good and helpful information. So Jennifer Labrie, thank you so much for being with us. We appreciate it.
Thank you very much.